get started. Once again, welcome to our healthcare-focused webinar today. We're going to be talking about what it takes to land healthcare talent in 2022. I'm delighted to be joined today by Aram and Ron. Kyle, who's the Chief Operating Officer of Lead Health Staff, was going to join us as well, but he is under the weather, fell ill yesterday, tried his best to take a bunch of medicines and be with us today, but he could not. And we wish him well. We want to make sure he rests, but we will have a really productive, a really useful conversation with Aram and Ron today. Before we get started, just a couple of housekeeping things. First of all, thank you so much again for spending this time with us. We appreciate it. We absolutely love questions, so please ask as many questions as you would like. This is very much meant for you. These industry thought leaders are here to share their experience. So if you have real life questions, shout them out anytime. You can add them in the Q&A panel. You can ask them via chat. We will absolutely take questions in the middle. Or if we have to save some time towards the end, we'll do that as well. And if there's any question we don't get to, we will absolutely make sure we get back to you over email later on. But it's our promise to you that we will also end on time in respect for your other meetings. So we will absolutely end on time, but we'll try and take as many questions as we can. This presentation, as well as the recording of the entire conversation today, will be distributed. So don't worry about taking notes or screenshots. We'd rather have you be interactive and spend a lot of time talking to us. This is our agenda for today. We're going to start by introducing our speakers. Then we're basically going to get into a Q&A with the panel on, how do you essentially be successful in healthcare staffing today? How do you land healthcare talent in the world, in the environment that we're living in today? We're going to keep time for Q&A towards the end, but we'll also take questions as we go along. So with that, let's get started. Like I said, what we're talking about is what it takes to land healthcare talent in 2022. I'm absolutely delighted to be joined today by Aram as well as Ron. Sorry about that, guys. Aram, Ron, thank you very much for being with us today. If you wouldn't mind, it will be helpful for our audience to know a little bit more about you, your role, as well as the companies you represent. So Aram, if you don't mind, I'll start with you.
Sure. Awesome. Well, Pankaj, thanks for having me today. Really appreciate it. Good afternoon, everyone. So Aram Hampoyan, President CEO of Core Medical Group. We've been in business over 20 years. We focus mainly on clinical. Travel nursing is one of our largest segments, travel therapy as well. We also have a locums department. We've just recently, in the past 2 years, launched an interim leadership department. And then we also focus on perm placement as well, and that is in the RN space mostly. I myself have been with the company for 17 years, started as an account executive in the therapy group, and have worked my way up. And if you were to ask me my experiences, the first 5 to 7 years were all in the therapy space. So that's kind of like my baby over here at Core. So really appreciate everyone taking the time out of their busy schedules, and I'll kick it over to Ron.
Hey, thanks. Glad to be here. Thanks for having me. Soliant has been around for 30 years. We're a healthcare staffing firm as well, focused in the nursing areas, allied areas, lots of different disciplines within that. We are based in Atlanta and literally just celebrated our 30-year anniversary in May. And I was fortunate enough to be here when we started that long ago. So it's hard to remember what it was like back then, but it looks much different than it did 30 years ago.
My God, Ron, I think my dad spent his entire life in one job for 38 years, and I think you're about to break the record.
Yeah, I'm getting close.
And for those of you who don't know me, my name is Pankaj. I'm one of the founders of Sense. Obviously, started when we started the company about 6.5 years ago. And just to piggyback for a second for anybody who doesn't know about Sense, we started with a singular vision of building a talent engagement platform that was designed specifically for the staffing industry. We've stayed really true to that mission so far. We serve over 700 customers today, every single one of which is a staffing company. We work with 7 of the top 10 largest staffing companies in the US. And we also serve over 70 or over nearly a third of all the largest staffing companies in the US. These are companies as recognized by SIA with over $100 million in revenue. We're SOC 2 type 2 certified, which is a rarity for a company of our size, but that tells you how seriously we take our customers' data. And in this 6.5-year journey so far, we raised about $90 million in capital from some of the best blue chip, investors that one can hope to have on their board, as you see below. So that's a little bit about Sense. Why did we want to talk about healthcare? Obviously, it's no secret that the last 2 years have been a complete sort of upheaval for the healthcare industry as we lived through a pandemic. And the remnants of that today show up in what we're calling the healthcare challenge. Think about all these statistics that you see here. The average turnover cost for an RN is over $40,000. An average hospital is losing over between $3 to $6 million. There are 10% of RN positions that are still vacant, they're still open, and the time to hire is absolutely increasing. It's about 90 days. So as you can see, it's super hard to find the healthcare talent. And at the same time, if you think about this, it is coupled with the recruiting challenge itself. There are, candidates who drop off after they talk to you. 51% of the nurses are saying that this job impacts their health. In fact, as high as 40% of them say that they don't plan to do this job forever, or they don't plan to do this job after a certain amount of time. So that they're actually going to be dropping out of this discipline. And there is still a large amount of attrition because of the travel involved, because of the times that these folks are working, because of the breaks that they get. We're obviously all very thankful to healthcare professionals, but it's a challenging industry in terms of what the recruiting funnel looks like. And even with that, we're nowhere close to filling the demand that actually exists today. So this is the basis for our conversation today with Aram and Ron. What are some of the challenges that they're seeing today? How can one pivot their business? What are some of the tips and tricks on engaging with people, retaining them? What are some tips and tricks in terms of using technology to help with this process? And of course, answering any questions that you guys might have along the way. So with that, I want to dive right in and start talking about recruiting challenges. And I want to start by asking, what are some of the challenges, Ron, that you think you faced in hiring healthcare staff, particularly since the pandemic? So Ram, if you don't mind, I'll throw this one at you first.
Sure. Yeah. I can't say I was super excited for this question because it just makes you think about what was happening in 2020 when I first saw it, when Pankaj, Ron, and I were discussing this. I would say when COVID, the first wave came for us, I think in 1 week we lost over 100 travelers on staff that were terminated immediately by facilities, and that was mostly in the therapy space. Of course, patients weren't coming in to do outpatient. And it was really just at that time, everyone was concerned about going anywhere. And then we had a, contract with all of our clinicians out in the field, and we were telling them, hey, you can't go to work tomorrow. And so our first big decision was, all right, what are we going to do here? Are we going to pay these contractors? And then we can't bill for the clients. And that's really what we did. So our first decision was really trying to stay committed to our travelers that were in the field that were terminated immediately for no cause whatsoever, and trying to partner with our clients to make sure that their businesses weren't going to suffer. And so that first initial wave, those first 4 to 6 weeks, especially in California, were, we thought, critical for us to just show that to our clinicians in the field that we are going to be committed to them and that we were with them at every step of the way. And so that was the first, real challenge that we faced. And then after that, it was, okay, now that we've hit that initial wave, where can we find, assignments for these candidates who were also committed to moving their belongings and everything out throughout the market? And I think our team did a fabulous job, at least initially on the therapy side, of trying to find clients that wanted people to work that couldn't find them. We were placing therapists and CNA roles, and that was unheard of there for a little while. And great job by our team trying to figure out, how do we keep people employed at a time where some people did not even want to go into work, or there was just so much chaos, we'll say. So that was the first challenge we had. From then, after that came back, it was, all right, now we've got people who want to go to assignments. How do we get them medical services? How do we get them to get a TB test or a drug screen? Because so many of our partners, like a Concentra, were closed. And so you would send someone for a drug screen, they'd go there and it would be closed. For a while there, it was like a whack-a-mole trying to find a place that was open that would be able to perform the services. And we really felt for the clinicians who wanted to get to work and they couldn't get there because there was just nothing open at that time. So I would say those were our first few challenges, with the pandemic, and just trying to, what we thought was a simplified process, as simplified as contract, work can be, and it just getting thrown into upheaval at every step of the way.
Got it.
I'll kick it over to Ron to see if he's got anything to add.
Well, I was going to ask you, Ram, so as part of this, were there any new administrative processes that came up, and how do you think sort of maybe technology can help with that?
Yeah, so we have, I tried to think back how many times we met as a leadership team. To each week there was like a new issue or new something that had arisen we had not heard of yet, and we would create a process, it felt like, every week. And I felt for our teams, because we would leave those meetings and then push something down as like, hey, this is how we're going to do this going forward, this is how we're going to do that. So I would say the one thing that we definitely learned that has been a constant talk is automating process from an operations side. We always thought from automation of how do we automate more leads into the recruiter's hands, or how do we get more opportunities in front of our sales team. But I don't think as an organization we really thought of how much we could automate from an operational standpoint, and where we really needed to focus, whether it was in credentialing or whether it was in payroll or any of those areas. We did a lot of looking down, top down, of what can we take off our team's plate from an efficiency to create more efficiency. And I would say from an operational standpoint, HR, quality assurance, and payroll, that's where we saw the biggest bang for our buck at that point in time, because we had so many more clinicians on staff than we had previously. We really needed to maximize on a per desk basis from the operations team.
Got it. Ron, would you walk us through what are some of the challenges you guys saw, or any new administrative processes that sort of came up in the last 12 to 24 months?
Yeah, absolutely. I relate a lot to what you said, Aram. Except you said it felt like something new every week. It felt like something new every hour for several of those months in there, and just so much change and chaos. I'm thinking, further into the pandemic, and really as we've the last 12 months, we've just experienced so much turnover with so much demand, people jumping to other companies, recruiters, operations. That has been a huge pain point for us. And obviously it's a pain point for us to grow internally if our people are leaving to go other places, but the downstream effect that has on our travelers, and just the inconsistencies that come with a new person that's jumping in to pick something up. We just saw so many things fall through the cracks just from not communicating consistently the information that our folks out in the field need to do their jobs efficiently. So I would not say we've mastered this yet, but we really went to work on building automations that took those things that often fell through the cracks, especially with enhanced turnover, and made that a systematic thing that would deliver that information, or at least deliver notice to a manager or someone else that is more likely to be in the organization long term, so that we don't lose things.
Yeah, no, makes sense. Super helpful. And just for the benefit of our audience, one of the things we're going to keep doing is, I've collected some of Aram's and Ron's thoughts and actually tried to put them in takeaways. And the reason I did that is because afterwards, if somebody's just looking at the slide deck and not the entire recording of this webinar, you can still find some quick sort of tips and tricks. But with that, let's keep moving. And Ron, I was going to say, okay, so there are all these challenges that exist. Obviously you realize there are changes that need to be made and you have to pivot quickly. So, talk to us about what is that process like? How quickly did you realize that, that you need to make sort of recruiting changes? What was your approach to that?
Yeah, I mean, for us, it was immediate. Just we knew things were not gonna make it through at the pace we were moving. So we tried to jump in quickly, and it really, I mean, it did feel like a day-to-day tweaking of how we were approaching things, just experiencing things we'd never experienced before at a pace that we never experienced before. And you know, part of our response to the market demand was hiring. So we went through a large increase in new recruiters. At the same time, we ended up turning over a lot of people. But you've got the turnover effect, but you also have just the fact that we have to train a lot of new recruiters to keep up with the demand that we were facing. So again, it's a lot of the same answers for us was how do we automate this and make it more seamless to get people up and running as internal staff and to keep the people out in the field running and receiving the information they need.
Got it. Ram, how about you?
Yeah, so for us, I would say very similar, to Ron, is that it was changing hourly, if not daily, on our recruitment. What we were doing pre-COVID was not going to work post-COVID, and what worked in 2020 was not going to work in 2021. And so our recruitment strategy definitely changed. We really tried. I remember I was joking with someone at Sense that we started hiring automation specialists to help us, and I thought that was funny that we needed to hire someone to fulfill automation. But that changed us immediately once we did that. We were able to get more leads quicker into the recruiter's hands and get them more qualified as well. So it wasn't just we were sending 10 leads to a recruiter a day, it was that we're sending 10 more highly qualified leads to a recruiter a day. And that then we changed the structure of the entire process too. What we're doing pre-COVID versus what we're doing today are night and day different in terms of your intakes, your pre-closing, your post-closing. We wanted to really change, and then you also had the market was changing too, right? You had to qualify people a little bit differently. Auto offers were starting to become something within the market. Where previously a clinician would be interviewing the candidate, that wasn't taking place as much. So we needed to be a little bit different in how we were qualifying candidates too, so that we knew that they were going to be a quality clinician going into that hospital or into that agency or that long-term care facility.
Yeah, that's super interesting. You touched upon auto offers, which is sort of a brand new thing that I heard during the pandemic. So it would be great to sort of hear a little bit more about that as well. And I'm curious, Ram, about what are some other creative ways in which you guys source talent in this industry. I mean, are you relying more on referrals? Are you reactivating your database? You talked about auto offers. So maybe just walk us through what are you doing now to sort of land this talent in a whole new industry.
Yeah, so our old way of doing things was we'd scrape the websites, you name Career Builder, Monster, all those, back Indeed, and then we would shuffle the leads to the recruitment team. That's kind of changed over the years, right? Now we're scraping the sites, then we're sending the automation out. If the candidates are interested, then we'll send them over to recruitment. So we're not wasting a lot of time on the recruitment team anymore. We're really having those more highly qualified people talk to the recruiters and having the technology be that go-between rather than wasting the recruitment time. 35% of our new hire placements come from referrals.
Oh, wow.
One of our bigger sources for referrals is we do a trip called Club Core Med, where we take all of our clinicians who do a certain amount of hours per year. We take them to Mexico or Jamaica or places like that. And it's really just a place for clinicians to let their hair down, all inclusive. And so we not only do referral bonuses, but they also get points to qualify. And so we feel that is a differentiator for us in the market to try and get more referrals. It used to be 50%, but as we've grown each year, that number has gone down a little bit. So right now we're at 35% for referrals.
That's amazing. I mean, from my vantage point, that is probably still one of the highest percentages I see anywhere, Ram. So, you guys must be doing something right.
Yeah,
Ron,
testament to our team.
Yeah, absolutely. Ron, thoughts on this? Any creative ways in which you guys are sourcing new talent now?
Yeah, I mean, I think this is not really new and probably not going going to be surprised to anyone, but it was just surprising as we went back to look at some of our data and figure out how to get more candidates to fill all the demand that we were facing, how many of our candidates existed in our database that we just were not engaged with. So some of the things we did was just, things that are probably common sense to people, but build some automations that engage with existing data that's been sitting around forever, and let those bubble back up. So we do that with existing data. We do some workflows that help us track with new leads. So I don't know what you guys are like, but when leads come in for us, we either catch them right away and we're off to the races, or we try to and forget about them. And so many times things are just getting stale because no one else is reaching back out to them. So we've got some things in place that now catch those after X number of days and re-engage them. And that floats back up to a leader that will then assign someone that they know will follow through on it.
Yeah, and Ron, I'll add this. I mean, you were very humble in saying that this is pretty common, and I can see how this is common sense, but I work with hundreds of customers where people are still not doing that. They're still not mining their database. They've spent millions of dollars over the last 10, 15, 20, in your case, 30 years, paying job boards, just building all these people. But that data is stale. They don't know how much money these people want now, where they're located, what kind of job do they want. So it's just a stale database. But if you reactivate that, you absolutely can make that your most sort of secret and effective weapon, if you will.
Yep.
Listen, so Ron, I'm getting a bunch of questions from the audience. So we're going to do a little rapid fire here. I'll basically throw it at whoever wants to pick these up. But since we have a lot more questions to go here, but I want to make sure we get to the audience questions. So first, Aram, I think this is for you. What technology are you using after you scrape sites to qualify leads before they go to the candidates?
Yeah, we actually don't use the technology for that. We have people that specifically their job function is to scrape all day, and to each one of them partners with a different team, and they focus on where that team is looking. So if ICU-RN or could be OBGYN, doesn't really matter. That team is focused on with that specific sourcing department. So that is not technology.
Okay. The other question I got is, do either of your businesses run on EOS?
I would say no, because I don't know what EOS stands for.
Same here.
I don't know what EOS stands for either. So whoever asked that question, please tell us in your chat window what EOS means, and we'll come back to that. Another question, what can one do differently to initiate a vendor process for healthcare firms? For its staffing needs, for its staffing needs vis-a-vis financial or IT firms. Any thoughts on that?
So this is we'll say a hospital looking for vendors. Is that what I'm understanding? Is that?
That's what I'm going to assume too.
Okay, all right. Well, I would first ask leaders in your space who they're currently using, right? There's nothing better than getting a referral and understanding that the partner at the hospital across the street gets good service. So I would probably start there versus a Google search myself. I know when I'm going to pick a technology partner, I know all the referrals I get from them are going to be good. So I try not to find ones that they give me. I try to find ones that, I know are straight from the horse's mouth, we'll say, that is going to be a little bit more transparent, I guess. So that's the way I would do it. But I'm sure if you call Ron or I, would be happy to help you too.
Got it. I got another question that says, are you concerned with the increased government scrutiny of the travel nursing industry and the fees that were being charged during COVID that seem to have carried over due to staffing shortages?
Yeah, I can't say I'm not concerned. Ron, you want to take that? I'm happy to.
Yeah, no, I think I would say the same thing. Always concerned, but there's not a whole lot to do about it other than see how it shakes out. I have lots of reports of price gouging and that sort of thing, which is funny to me because in most cases we were taking the prices that the clients offered to us. And in our case, I think around the industry, it's most of that went to the nurse as well. So we'll just have to see where some of those hearings land.
Yeah, I think education is really the most important, ASA, NATHO. I mean, I know they're trying to educate the leaders within either federal or state levels. I know we spoke to our local elected officials and really just educated them on how the market works. A lot just think that, you charge 200, you're paying 50. Like that's not reality,
Right.
And so it's really just about, I've spoken with a couple of C-suites this week that just aren't fully immersed in like how our costs have gone up. Like even if the expectation of a clinician hasn't gone up over the past 2 years, all of our costs have gone up. Our workman's comps are up, our benefits. I mean, every business is facing that. So I'm not saying that justifies the rates that we have seen over the past couple of years, but overall, I do think that it's really just about education and how a bill rate works and what happens from that is most important.
Totally agree.
Got it. Thank you. Ram, this one specifically for you. How much is your referral bonus?
It's $1,000 on average. I don't think we exceed that anymore. We've done it in the past where we've done like 1,500 or 2,000, but right now it's $1,000. We used to tier it based on the clinician, but we don't do that anymore. We just try to make it simple, cut and dry. It's $1,000 and they get 1 point towards our vacation. If you get 4 points, you get to go on the vacation. So in reality, you don't have to work for CORE for 1 hour. If you give us 4 referrals, you can go to Mexico for free, all expenses paid, and get $4,000.
That's wonderful. Amazing. Ron, this one's specifically for you. How is Ron re-engaging former candidates in the database? Are you using automation? Are you sending out a survey? If so, what are your response rates like?
Oh, that's a great question. Yeah, we're definitely using automation for it. It's really going to be based on skill types and dates of last activity to decide who are we engaging with. So we target certain skill types, definitely target dates in our system. I don't know the response rate. I'll be happy to talk with our marketing folks that run some of those and pass it along to you, Pankaj.
Yeah, no, absolutely. And this is one place where I feel like I'm dying to add something. And I was going to say, I know Ron is using automation because, we've been working with Ron and Ron's team for a while. This is sort of exactly what I was talking about before, which is automation now gives you the superpower to do this as broadly or as narrowly as you would like. What I mean by that is broadly, you could reach out to 10 million people in your database, and within 15 minutes, you can ask people, hey, are you still looking for a job? If you're not looking for a job, when will you be looking for a job? When you will be looking, what kind of money would you want? Which zip code would you want to work in? Where would you want to travel? What kind of credentials do you have? I mean, you can get all of this information at a broad level within like minutes, seconds. You can get as narrow as you want and essentially go, hey, I want to reach out to everybody who lives in Chicago, has this kind of specialty, has Cubs as their favorite team, if that's what was your thing. But you can get as narrow as you want using automation. You build it one time and it runs automatically, but you absolutely should make sure that this database, and in Aram's case, for example, this database that sometimes you're paying $1,000 a person or $2,000 a person to get them in your database, that you're not just using them one time, that you're making sure that after you've gotten them one assignment, after they've worked for you, you're either redeploying them or you're re-engaging them, so on and so forth. So, I guess on that topic, I'll ask you both a follow-up. I mean, once these candidates are sourced in their place, what's most important for their satisfaction and loyalty to ensure that you guys actually get them redeployed?
Well, I think 2 things for us. It's getting started on time and getting paid on time, which seems like, again, basic things, but when you get to a size and some complexity with your systems, it's not always easy to pull off. So that's where we've let some of the automation work fill in those gaps for us. And then one thing I didn't mention before is we did part of what we've done in the last 6 months is move to a digital onboarding tool as well. To improve that experience for candidates as they are on their way in the door. Traditionally, a huge pain point for us, and I would assume most of the industry struggles with getting people started on time everything buttoned up the way clients want it, but we're just leveraging technology as much as we can to improve the efficiency and the effectiveness of how we deliver that to the candidate. So for us, just keeping everything running as smoothly as possible, and certainly being there, accessible, communicative throughout the process as well.
Ram,
I
how about
can't
you?
I can't agree much more with what Ron said there. You know, you are you've sold a clinician on your service. You need to deliver that service. You need to get to the start date. You can't be setting unrealistic expectations that you can start in 2 days when you know it's going to be 2 weeks, right? Like that's not there. You have to pay people on time. Their benefits have to be seamless. Your communication style with them needs to be as seamless as possible. You don't want your recruitment team to call and be like, hey, we don't have this. And then your QA team to call 2 hours later and be like, yep, we've got it. It's all set. You know what I mean? Like it's
Yep.
got to be as seamless as possible. And for that to happen, your sales and your operations teams need to be a well-oiled machine. And if they're not, that's where it starts, in my opinion. So I think you just need to deliver on what you've promised to that clinician. And if so, you're going to be A-okay.
Got it. Got it. Awesome. I've got a broad question here that says, which automations do you suggest? And unless any one of you wants to talk to it, one of the things I was going to say was, this is obviously something we do day in and day out. Happy to, whoever asked that question, happy to get into a more detailed conversation with you. And when I do, this is not a sense commercial. I absolutely know what Aram's team is doing and what Ron's team is doing. So also happy to share some of their non-proprietary information on things that I think are best practices in the company. All right, I'm getting non-stop questions here, guys. So I'm going to try and move on, but I'll also ask you a couple of them, which kind of feels like are more straightforward. So one was, what follow-up process / strategy do you find works best with new leads, as far as initial call to first follow-up or to second follow-up?
First call this out. Well, number one, I think if you're sending automation out and a person has answered questions, you need to get someone to talk to them as soon as possible. There's nothing worse than having a conversation with an AI to then not get a response from the company in 48 hours, right? Like that's not. So I think speed to market is most important on that initial. Now, I don't know if I'm answering the question fully because it sounded like if I've reached out to someone maybe 4 times, what's the best strategy? Is that?
Yeah, and I can take part of that. I mean, it sounds like whoever asked that question is talking to a little bit about how do you create an outreach sequence or a drip campaign.
Okay.
I'm certainly happy to talk more about that offline as well. But there are absolutely best practices on how many times and how often should you hit people within 15 days or 20 days to make sure that they will either respond, or for certain that they're going to be a dead lead or a passive lead, and you shouldn't waste your time on that. The other question we got was, which applicant tracking system are each of them are using? And I'll just answer them for both of you and say that both Ram and Ron's companies are using Bullhorn as an applicant tracking system. And then lastly, here is a suggestion for you, I think, Ram, where somebody said, have you thought about putting a note section for each contact in Sense? So
note section. I don't even know. I haven't been in Sense since we started that contract like 4 years ago, but we use Bullhorn as our place of record. And so everything lives in Bullhorn. Any note coming, any communication coming in or out of Sense automatically gets put into Bullhorn. For all of our technology that we partner with, Bullhorn is our place of record. So there shouldn't be anything in or out of the organization. Calls, emails, you name it, it all sits in Bullhorn.
Yeah,
I think that's what they're referring
that makes sense.
to.
And as we are talking about following up with people, staying in touch, sequences, another follow-up that I have for both of you is, obviously, let's say one of your healthcare professionals or one of your staff members does go elsewhere once their placement is complete. How do your recruiters sort of, stay in touch with them or nurture them to kind of reobtain them for your positions?
I think Ron was doing this. I actually heard it a little bit earlier on the dormant side. We're fairly new to it. We know that's a hole in our game. We've just started it over this past quarter. In the past, we would rely on the recruitment team to have a hit list, let's say, or a running Excel spreadsheet of who they lost, and the managers would keep track of it. But we've since changed how we're operating within Bullhorn so that it can then feed an automatic campaign, whether through SMS or through email with Sense. And again, it's very early for us, so I have no statistics on it, but I'm really excited about it because we do think that things, I think Ron mentioned it earlier, right? Things fall through the cracks. We're all going a million miles an hour in this industry, and it's really great to have that built out. We're hopefully going to capture a lot more people back. We have an over 70% rate of retention. So I feel like we're doing pretty good, but I know there's room for improvement. I talked to other organizations that are close to 80%. We're in the low 70s. So I know there's opportunity there for us. And we're really excited about that aspect of the technology we haven't used yet, but just started in the past 60 days.
Yep, awesome. Ron, do you want to add to that? Because I know you do a lot of automation to stay in touch with people, right?
Yeah, we do. I mean, it's a similar story though. We're just probably a little bit ahead of you guys. But it's so funny though that your hit list, we have our same sort of version of that, and that's worked well until, of course, that candidate or that recruiter leaves, and that hit list just goes by the wayside. So we, again, I'm repeating the same thing you just went through, but we've already set the automations up that will catch people in those skill sets that we're interested in pursuing, and those date ranges that we're can see that we're just not maintaining communication. So we could get. I couldn't get into the details and tell you exactly what we're targeting with that, but it is almost as simple as that. Is here are the parameters of the people we want to continue to maintain contact with, and here are the date range to hit them up with some sort of message once we pass that threshold.
Makes sense. Makes sense.
It works. I don't know what the rate is on re-engaging people. I think it's good, but if you think about it, it's so low cost. There's no time that someone is sitting back there doing that. Once you set up that initial workflow, it just runs in the background. So it's a very cheap way to re-engage with your folks.
I was absolutely going to say that this is very much a set it and forget it workflow. You do it one time, you can sort of have your own strategy on whether you want people to hear from you once a month, once a week. You can certainly send them, hey, here is how the company did in the last 2 months, or hey, we've opened a new location, we've added a new facility. They're just so easy to sort of build a cadence, but it can over time start going out to hundreds and thousands and tens of thousands and hundreds of thousands of people. So they're always hearing from you. And specifically, I was going to connect this back with what Aram said earlier. Anybody can send a referral, like Aram said, and if you can just get a referral from somebody who used to maybe work for you before, you can probably still pay them the same $1,000 because you're going to get the candidate, you're going to make your gross margin and spread and money. But that way you always have this brand where people are saying, hey, I worked for Core Medical one time, but I just made money from them last week, and I'm going to make money from them 3 months from now, and just becomes part of your overall impression on how they've been nurturing you, even after you were just even that you're now an ex-employee and no longer an employee. Quick question, or I'm guessing this is for you. Are there any free sourcing tools you could recommend for recruiters that are focused on RNs aside from LinkedIn?
We try to keep our recruitment team off of any websites. Honestly, we want them living in Bullhorn, and we want that other team living in the LinkedIn or the Indeed worlds. Our recruiters are really know Bullhorn in and out, and we want to give them the most opportunity as possible by adding in as much into that database. And so the only time that our recruiter would ever add a candidate in is through a referral. Otherwise, they're never adding in a candidate into the system, and they're living and breathing Bullhorn. So I can't, unfortunately, give you any great tools from that standpoint.
Got it. And then I'm going to throw this last one at you, Ron, although I feel like I have lots of data on this as well. But what method garners the greatest response, SMS or email?
Oh, no, easy SMS. That always gets a better response. It's just, you got to be careful how much you text people. So we're trying to balance that. We get a better response from this, but if I send it too much, they opt out. So we try to balance that as we build out those workflows and not overuse one versus the other.
Yeah, and that's exactly what I was going to say. Obviously, email, gets low single digits in response rate, sometimes, even on 5 to 7%. Text messages, more than 90% of them are read within the first 5 minutes. More than 50% of them are responded to. Obviously, like Ron said, you want to make sure your text messages are relevant. I mean, if you want to send somebody a text message that says your job's confirmed or your assignment's extended or your pay rates changed, you're just going to see a huge amount of engagement. And if you ever send somebody a text message that says, here is a link to our new newsletter, that's when people start dropping off, and that's when people start unsubscribing from. So these two are very different mediums to be meant for very different purposes. And obviously, we're more than happy to share best practices, but as long as you keep them in mind, I think you'll be super successful. All right, so last follow-up question in this particular segment around attracting talent. What do you guys do to capture feedback on people who you've placed on their placement satisfaction or placement satisfaction towards your recruiters? I mean, wonder if you guys are doing NPSs or surveys, but Aram, do you want to take this and tell us what are you guys doing towards satisfaction?
Yeah, so thanks to Sense giving us some roadmaps here. We did start with an NPS survey, and so we had always asked candidates like, hey, rate us on Glassdoor, rate us on Facebook. That would come from recruitment. Not all recruiters are comfortable asking that question, and so we started at the end of all of our journeys that we asked them to rate our quality assurance department. How was your payroll experience? How was your recruitment experience? If anything goes 6 or below on NPS, it goes to the manager of that group, and they are to reach out to the candidate. I know for a fact we've saved a lot of placements by getting early feedback that things aren't going well. And, unfortunately, sometimes you don't get that feedback until the last day when the candidate might be terminated or candidate unfortunately might walk off. We're getting ahead of those problems a lot sooner right now and have been for the past couple of years. So that has been great. But I think one of the best stories that I have from the NPS side of it was the team who leads our Sense over here. They came in one day, we had a meeting. They're like, hey, we just won an award, like to work for. And I was like, did we fill out a survey? Like, how did we get into this? And they're like, no, we didn't fill anything out. We're not even sure. Come to find out, we had gotten so many positive responses because the NPS survey, we were getting 10s on Google, Facebook, Glassdoor. We ranked so highly because we were asking that question every time, and the team executed. We won, I think, 6th or 7th best travel company to work for in the country, just because we asked this one simple question that we would maybe ask, but not all the time. And so from an ROI perspective, I saw it immediately that day. I was like, holy crap, we just got so many positive responses over the past year. So for the past 2 years, we have been ranked top 10 best places to work by a publication because we just asked that simple question, how did we do? And then please go to Glassdoor or Facebook or whatever it is, the medium that they're using.
That's amazing. That's absolutely, that's making that's making my heart fill with pride. So that's awesome. Ron, any thoughts on what you guys are doing to capture satisfaction data?
Now we take a similar approach with surveys that alert managers. I will say I don't think we're quite as advanced as you guys in terms of aggregating the data and doing something with it from a bigger picture perspective. But if something goes wrong, at least it gets risen to our leaders that can step in and make some adjustments. But yeah, I love that feedback, Aram. It's there's a lot of opportunity for us to learn from what you guys are doing.
Yeah, happy to talk offline about it, Ron.
Awesome, thank you. And I know we've covered a lot of this as we were talking, because we were just talking about candidate engagement a lot, but just, in case I'm missing any thoughts from either of you, I'm going to ask this again. But what have you found is necessary to keep candidates engaged about their next placements? There's obviously been a negative impact of about morale in these past couple of years. So Anything else that you'd like to sort of add here? I know we went all over this topic, so I just wanted to give you guys a second to see if there is anything else that you wanted to add in here.
I'm happy to go. We
Please.
try to talk about Club Core Med, our annual trip as much as possible. We know that clinicians are burnt out. We know that they're looking for release. We had to cancel it for a couple of years because, unfortunately, because of COVID, we had our first one in quite a while this past year. And it was incredible just to see everyone, a lot of the same faces, and we all go to conferences. Think of it going to a conference without the breakout sessions, just the fun part. That's what this trip is. It's all people in your industry that all travel together and all get to hang out for 5 days together. And that's really what it's about. So we try to talk about that as much as possible, but we still want to keep the human element a part of this, right? Like, we're talking a lot about automation here. We're talking a lot about, AI. The reason a lot of our clinicians choose to work for the organization is really the recruiter. And so you have to have the recruiter aspect in there too. That relationship is still very much key in what we're doing. And so there has to be touch points that are human elements too, that I think really keep candidates engaged. That's just a personal opinion.
Yeah, and this is not really an addition, but for us, it's a little more simple in that just executing on the idea of speed and communication and consistent communication. It's surprising how much that drives engagement, and surprising how often, I'm embarrassed to say this, but how often when I do hear a problem, it comes back to, I just didn't hear back from that person. So just really some basic execution for us that drives a lot of that engagement and keeps people excited about working with us.
Awesome. And Ron, do either of you have any thoughts on the credentialing process itself? Like, what can one do? Can you do some part of it without the offer? Like, how does one help sort of, how can you work with that particular part of the process to speed things up?
Yeah, I mean, there's some things you can't do without an offer. Obviously, you know that based on the way you asked the question, but there's lots of things they can share ahead of time. So helping our travelers understand what they can do ahead of time. We, with this automation or this onboarding tool, we haven't executed on this part of it, but there's the whole pre-hire workflow where we can build out an automation based on the type of job they're interested in, or even name a specific job before they have a offer that would let them know what the requirements are, then allow them to go ahead and begin that process of uploading documents before they even have an interview. So education and just giving them a conduit to provide information for us.
Got it. Okay.
Ron's 100% correct there. I wish we could do it. I mean, if anyone could figure out how to do credentialing faster, that's the multi-million-dollar.
Yes.
And that's why I think auto offers were created. Like, auto offers were created so that we could all get people credentialed quickly, because credentialing was such a bear during that time. And so that smart organization started to realize that and know that we can get people in sooner by doing that. And but yeah, no, Ron hit it right on nail on the head on that one.
Awesome. Hey, we talked, I think, about this topic as well, but I'll just bring it up once more. So let's, for the moment, let's step away from the candidates, the talent, the redeployment, the reactivation. Let's talk about the recruiters itself. And Ram, obviously, you talked about that with the Club Med, with the Club Core Med trip. But how are you guys thinking about lessening sort of recruiter fatigue? I mean, if somebody asks me this question, I'll probably give them a whole discourse on automation. But you guys want to maybe talk about what are you doing to make sure that they are staying sort of happy and positive?
Well, for us, this has been something that I would say was happening pre-COVID. We have always tried to, we were probably once a shop of like work hard, play hard. And as the pandemic hit, we started to see fatigue, and we really have started to get a pulse on our team. We use a product called 15 and 5, and that product has really helped transform our entire organization. We get a weekly pulse check from every employee, not just recruiters, on what's happening, what's going on. I just talked about earlier on how you want to get a pulse check from the clinician in the field on if they had a bad week, so you can get ahead of it. It's no different internally. We're trying to get ahead of any problem that might exist on any team whatsoever and try to overcome that and talk it through. So that for us has been something really, one of our core values is transparency. We're trying to be transparent with our employees as to what we're doing organizationally, and we're hoping they'll be transparent with us on how they're feeling. I will say that at the beginning of the pandemic, it was, of course, a little bit tougher. Being in multiple markets, some markets have been really good and some markets have not been good over the past couple of years. And so the ones who have been good, you don't have high turnover, and the ones who have not been good, you have high turnover. And trying to keep that employee morale in those teams that haven't had the best of years has been difficult, not going to lie there. But I also think the technology does play a factor in it. I do think that as we've added more automation or different technology onto our stack, it's all for them to be more efficient. So if they once worked 10 hours to have a certain amount of people in the field, the goal is that they're working 9 hours now to keep that and maintain that certain level. So I think they're seeing that we're trying to do different ways, different things to keep them more efficient, and it'd be on them if they want to work those 10 hours and grow, they can do that. And if they are happy where they're at, they can potentially get more of their life back and have better work-life balance.
That's awesome. Ron, any thoughts to add?
Yeah, I'm really a similar story. It's just leveraging the technology, making it more efficient. Really, for us, we found a lot of times it was not only making it more efficient, but just a better experience for our candidates. So when things go wrong, I think that creates so much tension, stress for our recruiters that really contributed to morale issues. So I mean, I think we're saying the same thing, and Ron would probably agree. That's a driving factor in it. But trying not only to make it more efficient, but make it all around better for everyone. We do a similar thing. I'm not familiar with the product you guys use, but we use some internal sense workflows to take a pulse on how things are going for us internally as well. So I think just being willing to talk about some of those topics and admit that we're not we don't have it all together, but we're trying to get there has been helpful. And for us, I don't know what you guys are like. We're back in the office, so being back in the office for a while and getting back to some of the things that were normal for us get-togethers and that sort of thing made a huge difference in morale across the company.
That's awesome. And I got a very specific question from the audience, which I think is super actually insightful. So obviously, so around the question is, recruiters today are using a bunch of different technology tools. How do you sort of train your users or recruiters on using all of this technology and making sure that they're sort of up to snuff like right away?
Well, it's not easy, that's for sure. We have a great training department. So anyone who starts with Core, we put them through a training program that we call Core University. It's a 3 to 4 week training program that gives them all the technology stack, basic recruiting skills, and they learn the whole organization. We don't usually design someone to go into like travel nursing or therapy. They go into this Core University class and they learn the entire organization, and then the training team is supposed to put them where we think they're going to be best successful. So if we think they could be a better locums recruiter than a travel nurse recruiter, that'll be learned hopefully within that training program. But that's where it starts. All the technology is learned there, our phone system, messaging, email, bullhorn, you name it. It is all learned initially there. And then once they go into a team, it is then to be reinforced. I will say there is a challenge between that Core University and what they're successful with. Usually, most people will gravitate towards whatever they're getting success with. And as time goes on, some of those technologies might fall off because they're having more success over here. And I totally understand that. So I think that's an opportunity for us as an organization. We teach it up front. We hammer it probably for the first 6 months. And then, hey, wherever they're successful, we probably have to do some better re-education after a year, 2-year time frame.
Got it. I'm going to really quickly ask this question that came from the audience regarding pay transparency. So they're essentially saying, do you start becoming transparent on your advertisements or the start of the phone conversation? At what point do you do that? And does Colorado/New York City laws affect that for you all at all?
Second
Yeah.
question, yes.
Yes. We historically, we're just not a company that puts pay on job postings until we have to. So we would rather have a conversation with the candidate, understand what their needs are and what we can do in any given situation. So we're typically going to try to do it after we have that first conversation.
Got it. Okay. We're 4 minutes away from the top of the hour, so I'm going to talk about the last topic here, also part of my favorite topic, which is technology. How can sort of technology help you with these challenges, with these processes, so on and so forth. But I feel like you guys sprinkled a lot of this during this conversation, so maybe I'll ask one or two specific questions. One was, I mean, what advice would you give leaders at other companies that are evaluating new technologies or automation technologies now?
I mean, I'll take the plunge. I just wouldn't wait. I feel like we got into it way late. So I think the benefits are overwhelmingly positive. So I just wouldn't, if you're thinking about it, get whatever information you need to, talk to whoever you need to. It's hard to argue with anyone that there's not a big benefit to you on it. And it's, I mean, the grand scheme is relatively inexpensive when you think about the value that you get from it.
Yeah, agreed. I would say that every time we look back on something, we'll probably say like, wow, wish we started that sooner, right? Like that totally agree with what Ron said there. I said this should be its own discussion topic on its own. We could talk about this for an hour, but technology of record, like where are you going to, like for us, it's Bullhorn, where are you actually going to keep everything, have that hub and spoke model, I think is really important. I think open APIs are a must. If you're going to have some of your technology with open APIs and some without, then I don't think that's going to work very well for you. I do think what Ron said makes sense, that you want to start and you want to go, but don't just add to add. Actually have a plan. Who's your project manager? How's your change management process within the organization? Are you communicating that? Don't communicate the day before you're going to have a massive technology change to your recruitment team. That's probably not going to go well. So what's your communication process? What's your change management process? And who's your project manager? Those I think are it's nice to say I want a technology. You need to really figure out once you sign what the process looks like internally to have it be a positive change to the organization. Because if it's not, it doesn't matter how great technology is, it's going to fail. Because if your team isn't behind it, it's done.
Yeah, they don't use it.
They don't use it, exactly.
Totally agree
Wonderful.
with you.
All right, we're at the last minute, so I'm going to give you both 20 seconds each if you want to talk about maybe has Sense helped your organization at all, and what are some of the things people should be thinking about a product like Sense and where it can come in and have a good impact, a clean impact.
Yeah, I mean, it's definitely changed our organization, front to back, front end sales, back end operations. There isn't anything probably. I thought our last annual review with Sense was at least very eye-opening for me. I don't go in those meetings as much. And the Sense team showed all the products that they have, what they're doing, and where core is integrated. And we are integrated in like 95% of it. And so I was very happy to see that we're trying to use the product as much as possible to try and get the best ROI out of it. And I would say that from a candidate experience, it's going great. And from a recruiter experience, it's going great. So it's touching many lives and making a positive impact to patients nationwide. And that's really what we're looking for.
Appreciate it, Ron.
Yeah, I don't have much to add. I would totally agree with what Aram said. I think we find ourselves looking around trying to find who do we have that can spend more time in Sense in building out automations.
Yeah.
So we just want to figure out how to get more of it.
Wonderful. And we're always here if there's any way we can help, or if there's any way we can help you build more automations, that'll be our pleasure. But with that, let's wrap. First of all, thank you so much, Ron and Aram, for taking this time. This was eye-opening for me in many ways, but you could tell by the dozens of questions I was getting constantly that folks were very interested in taking notes. Ron and Aram have shared their email addresses here very kindly if anyone has any further questions, as does Kyle for that matter, who wasn't able to make it today. But if you have any more questions, please reach back out to me. We will circulate the deck as well as the recording. And once again, thank you so much for taking the time out of your day to spend this time with it. We appreciate it.
Thank you, Pankaj.
Thank you.
Appreciate it.
Thank you.